Alrighty, so we're going to be presenting for our group community project. We're going to be going over Coccidioidomycosis, also known as valley fever, which most people will call it that just because a little bit of a tongue twister to say Coccidioidomycosis about 10 times. We'll probably go from alert noise times 4 to probably alert noise times 2 after that as well. So some introducing ourselves, I'm going to be Alan. We also are going to be having Alexa and Pradeep presenting this information as well. So going more into it, we're going to be having some objectives. Some objectives are going to be trying to, we're going to be hoping to give some just basic knowledge about the disease itself and maybe some education, whether it be of how to properly care for it, how to reduce your chance of getting it, reducing the spread of it, and anything like that. Raising community awareness, since it is such a prevalent disease in our area. We want to make sure we're aware of it and what it can do and what it looks like. Preventative measures tying into raising that community awareness and the knowledge itself. We're hoping to show you guys some preventative measures to take in order to help protect yourself, your family, friends, loved ones, and just the public in general. And then we'll be going over some resources available for you guys, whether it be of showing you where to go for information, such as the CDC. It's a great resource just to look at just for any kind of diseases and just knowledge about it. Also, having this PowerPoint and presentation up to the public, that's a great resource as well. And then just knowing for, in general, who can you go to if you do need help. So going off, what is valley fever? So valley fever is an infection caused by a fungus called Coccidioids. It lives in outside soil, dirt. So obviously we live around dirt, especially in this community. If you want to tie it into just the San Joaquin County, we're highly acclimated to just agriculture areas. We have tons and tons of wineries with huge fields of vineyards of grapes and just constant construction going on too. I mean, living in this area, I see tons and tons of construction going on daily. So tying into that, we have it to be known as the second most common fungal infection in the United States. It has a widespread spectrum. So whether you're a child or an elderly adult, you're going to be susceptible to this disease. It can be asymptomatic, which is showing no symptoms, or it could unfortunately come into play as a fatal disease. So also being aware that due to it's not going to attack a group more so, but it's just, say for instance, the elderly group is going to be more susceptible to it just because of their risk factors. They're going to be older age. It's just your body has a harder time fighting off infection compared to a younger individual. So being wary of that and being aware will hopefully helps realizing that you really have to take these measures to help yourself and keep yourself safe. So the way we'll go a little more into the next slide, but how to get valley fever, you're going to be breathing in those spores roaming around in the air through the dirt and soil. Like we said, some members of the community are high risk, but most people can get sick, but most people don't. 97% of valley fever cases are reported through Arizona and California. In California, we've had a increase of 213% from 2014 to 2018. And we'll be able to tie in the preventative measures. I was going to say, unfortunately, we don't have the previous or the most recent about 2 years or so from 2018 to 2021. But I would assume from my educated guess and knowing about the preventative measures and what we can do to help prevent the spread is that we actually should be looking at a decrease of cases just because of the whole COVID-19 pandemic and us having to constantly wear masks and just limiting the amount of people outside daily. I wouldn't be surprised if we've gathered information and we've had a decrease of cases. So tying into how it affects the body more so. So as we said, first and foremost is that you're actually going to be inhaling those spores that get launched in the air by, say you're working the field, you're helping out working construction, which is again a big prevalent in this area, and the vineyards and all the field work, working in those dusty areas constantly with the dirt and soil being tossed up in the air. And I have a huge chance of getting those spores in your lungs. So once they hit the lungs, they're going to be replicating, creating more spores, also known as spherules. They're just going to continue multiplying in your body and causing you to become infected, causing you to become sick. And it can also spread to other areas of the body. It could spread to your stomach, your intestines, your liver, just anywhere in the body it can attach to. And like we said, you can have symptoms, which we'll go over more, but you are more than likely going to be showing asymptomatic, which is no symptoms at all. And then going over some more statistics, we do have a graph here showing from the CDC, just tying into those all the years from 1998 to 2018. We see a gradual increase throughout the years, but we definitely see some highs and some drop-offs. But we have a total of 15,611 cases as of 2018, and 7,546 were just California alone. I believe it was about 7,000, just shy or just above 7,000. It was from Arizona. So Arizona and California are definitely your biggest ones that are the prevalent. And then tying in between Nevada, Utah, and New Mexico, there was only about 276 cases. And then other states, any other states that reported the disease itself, they only reported 311 cases. So we can clearly see how pronounced and how prevalent it is in our community itself. And now we'll be going over the symptoms. I will let my partners take over for this part. So go on ahead.
All right, for some symptoms for valley fever. So these usually last about a few weeks to a few months, and they usually appear 1 to 3 weeks after inhalation. And for most people, they're going to be asymptomatic. And in some cases where people might have symptoms, they're usually going to be like flu-like symptoms. And so you might have rash, fever, cough, fatigue, headache, chest pain, night sweats, shortness of breath, muscle aches or joint pain. And in some rare circumstances, death can occur from severe disease progression. So you want to catch your symptoms early and visit a healthcare provider if your symptoms are progressing. And some risk factors and prevention. So the people who are going to be higher risk for catching valley fever. So the Black and Filipino population is at a higher risk. People with diabetes and weakened immune systems, adults older than 65 years, pregnant women, smokers. And for prevention, this disease is not contagious. It doesn't spread person to person. What it does spread by is the inhalation of the spores through the wind. So you want to avoid areas with lots of dust, wear appropriate masks if it's like really windy outside, thoroughly clean cuts and wounds with soap and water to prevent any infection. And there is no vaccine for valley fever. So if you do happen to get the valley fever though, you do get lifelong immunity. So I'm going to pass it over to Alexa.
Okay, so the thing I'm going to start out talking about is available health resources. So the first thing I'll touch on is San Joaquin County Public Health Services. The number to contact is 209-468-3822. And this resource will give you any additional information in regards to valley fever, so they can educate you and lead you in the right way to what you need to do. Another resource is your healthcare provider, which can help diagnose valley fever. And provide treatment if necessary. Typically, mild cases clear up on their own. So if symptoms don't improve, that's when your provider will give you antifungal medications for the illness. The next thing for a resource is Centers for Disease and Control, Valley Fever Center for Excellence, and the American Lung Association. So these will give you additional information on the disease as well. The next thing I'm going to hit on is Healthy People 2020. So every decade, the Healthy People Initiative develops a new set of science-based 10-year national objectives with the goal of improving the health of all Americans. So the first topic from Healthy People 2020 I'm going to hit on is environmental health. The goal is to promote health for all through a healthy environment. So just making sure that we are aware of our surroundings and our weather conditions, and being prepared for the environment that day. So that leads into my next topic, which is preparedness. So the goal is to strengthen and sustain communities' abilities to prevent, protect against, and respond to any negative health effects. So kind of what Prep Deep touched on, making sure that you're aware of the environmental conditions that day, and wearing a mask if it might be windy or something like that. The next topic is respiratory disease. The goal is to promote respiratory health through better prevention, detection, treatment, and education efforts. So that's kind of what we're doing right now, providing you education on signs and symptoms, the treatment if it progresses, like antifungal medication, and just resources you can reach out to for additional education. The last thing I'm going to touch on is older adults. So the goal for older adults is to improve the health, function, and quality of life for them. They typically have some comorbidities, so it's essential to recognize any signs and symptoms of the valley fever and get them to the doctor just to make sure that the illness doesn't progress. So what we learned today is we learned what valley fever is and how it affects our community. We learned about the risk factors and preventative measures, along with resources for valley fever. And then these are our references for our PowerPoint. And thank you so much.